Good evening, everybody. Dr. Kosciuszko here. Thanks so much for joining in today on Wellness Wednesday, your weekly wellness tips. Today, for my chronic stress peeps, we're going to talk about gut health and how chronic stress affects and wreaks havoc on your gut health, and then how to reverse it. Okay. So, do me a favor if you are somebody who doesn't really go on Facebook much, you can go ahead and go to my YouTube channel, Dr. Missy Kosciuszko, also, and you can find a lot of just the video content for information purposes. So, if you're on YouTube a little bit more and you just want more on this topic, chronic stress, developmental abuse survivors, that's where you want to head for just the video content. All right, so let's dive in. So, chronic stress and the gut. What do I mean by the gut, really quick? So, your digestive system, particularly your intestines. Okay. Um, so, here's a couple things that you might notice if you are somebody who has chronic stress and you might have an issue with your gut. Okay, let's start there. This is where most people have questions with. So, I'm going to delve right into there. How do I know if I'm having a gut issue because of stress? Okay. So, um, you might be somebody who, if you're chronically, perpetually hypervigilant, if you have PTSD, if you're living in 2020, the age of quarantine and doing multiple things and roles from home, which pretty much is everybody right now, um, or you are a somebody with complex PTSD, any of those things. Your when your system is wired for that chronic stress state, what's important to understand is that this affects your organs and your health. Okay, stress is such a silent killer, so it's very important that you understand that the effects that this can have on your health, and then how to reverse those effects as well. Right. So signs that you might have an issue with your gut health. Okay. You're having a lot of skin rashes. So you are breaking out in hives lately. You're getting rashes on your face. You're getting eczema. You might be experiencing eczema would show up as like dry patches on particularly extremities, elbows, hands, knees, things like that. Um, so any of those types of things. You notice more yeast infection type symptoms. Some of those are self explanatory for female. For male, they may even be yeast infection in the feet, in the nails. So, noticing if hands, nails, or feet are turning yellow. Chronic yeast infection, athlete's foot, can be a sign of lowered immunity because you're not able to fight. Your immune system is down when you're chronically stressed. Okay, so you might notice that more, that you have inability to um, have fight infections as much, and particularly yeast. Okay, so you're noticing more yeast infections, you're noticing more bloating, and a lot more like specifically like gas type symptoms. You're noticing a lot more intermittent constipation, diarrhea kind of symptoms. You might be noticing that um, you are sensitive to certain things. You might be noticing that you have a lot more body pain or fatigue after you eat certain things. So these are all kind of signs that you may be having issues with your gut health. Okay. Another one would be actually like systemic pain or swelling. If you notice swelling, especially after eating certain things. Okay. So it's important to understand that when you're in a chronically stressed state, your immunity is reduced. Okay. And what the being in a stress state, your body is naturally, again, is going to use more of that sympathetic nervous system versus the parasympathetic nervous system. What does that mean? Your blood flow is naturally going to go to things like your muscles, your heart. things that you're going to use for fight or flight, correct? So that is not going to be your digestive system. Right? It's not going to be your detoxification system. It's not going to be your filtration in urea. Like your organs are going to have less of a chance to work correctly. You may even have a lot of absorption issues. Okay. What chronic stress is going to do is actually going to not only lower your immunity, which is about 80% found in your GI tract, by the way, and a lot of it through commensal bacteria. Okay. So essentially, what I'm saying is that not only is this going to affect you on a physiological way where you're going to get less blood flow and less working of your digestive system to do its job, you're going to get less immunity. What does that mean? We're going to have less ability to fight infection and pathogens. So, if you are somebody who is in chronically stressed, you might actually have a more susceptibility to getting more pathogens coming into your body and not able to fight them. So, pathogens, viruses, bacteria, parasites, yeast, right? Typically, your body is not able to your especially your small intestine and gut health, you're more prone to yeast infections, you're more prone to an overgrowth of pathogenic bacteria, you're more prone to an overgrowth of parasites, you're more prone to that kind of stuff because your body is working less effectively at killing off chronic infection, and it's more shunting blood and function to more extremities. Okay. So that's important to understand. Also, over time, you have less trouble managing inflammation. Okay. Um, the other thing that can happen is this can actually cause because of some of those snowball effects, you may actually get damage to your gut lining. So, your gut lining is literally one cell layer thick. Okay, so what determines what goes in and out of the tube we put our food in, right? One cell layer thick. Okay, really important. That cell layer is kept together by a really tight junction, and essentially, what happens over time is the cells either get broken down from the high pathogenic load, or essentially like the pathogens giving off lots of toxins, inflammation. Essentially, the gaps within the cells are not as tight as they should be, and then what happens is they start getting broken down, and like heavier molecules start getting in. Okay. So it's like I usually give a reference to this as like breaching the Great Wall of China, right? All of a sudden it's like, okay, or like breaching a wall of a war. What's in the inside should be going out. That wall determines what comes in and what's being absorbed, right? Our small intestine absorbs most of our nutrients. So we're absorbing vitamins, we're absorbing proteins, we're absorbing fats, we're absorbing carbohydrates. The carbohydrates not as much, but this is a lot of that's a lot of function. Okay? And so when you have that disrupted and you have, pathogenic invaders happening, and you have a heavy amount of inflammation, you start having what's called leaky gut, which is those heavy molecules, your body starts having an immune response, right? And so stress over periods of time that's just prolonged and prolonged and prolonged can set you up. This is one of the things that sets you up for kind of an autoimmune effect. Okay, because that leaky gut aspect can amplify, it creates like a heavy immune response to a bunch of foreign invaders. It kind of, there's so much seeping through that your body's having an immune response to everything. Okay. So click that like button if that makes sense. I'm throwing a lot at you here, but it's really important to understand that, our stress and our emotional state really affects. our body, and our physical health. It affects us on um, all of our body systems. So, if you are somebody who also is experiencing depression, depression can be a big sign of gut health issues. Okay. What happens is serotonin, which is one of your neurotransmitters that helps with, it's like a happy hormone, right? That actually gets produced in your small intestine and GI tract. So it is so important if you are getting a high pathogenic load and you're not having good, healthy bacteria, which is what helps to create that, you are at a higher risk of depression. Right. So there's a huge gut brain connection here, that it's important for people with those chronic stress states or people who are survivors to understand that it's not just um it's not your just emotional state, it's really affecting your entire being, right? So um knowing that, knowing how it can affect us, here's how you can help yourself and how you reverse those detrimental effects. Okay. So, number one, obviously, there's always got to be a plan for de stressing and trying to, um, what's called stimulate the parasympathetic. So, the parasympathetic is like the wine and dine system, not the fight or flight, but the wine and dine. Okay. So, we got to get your body more chilled out, your blood pressure goes down, your heart rate goes down, your digestive system goes up, right? And you can do that with a multitude of things. You can do that through grounding. You can do that through body work with yoga. You can do that by acupressure or acupuncture. You can do that through chiropractic. You can do that through cranial sacral therapy. So lots and lots of hands-on therapies. Now, if you are somebody who is a massage also, if you are somebody who's like, don't touch me, I'm not comfortable with that, or it stresses me out more, that's fine. So there's things like that that you can do yourself, um, for stimulating more of, this is more like the vagus nerve type of therapy. So doing deep abdominal breathing is very, very important. So trying to sit up tall with actually your shoulders back and your head up and just opening the chakras here in the throat chakra will actually physiologically change your brain. When we sit in a position, try and get up if you're sitting in a position that's always seated, okay? Because that actually changes your physiology. If you are in a position where you're always hunched forward like this, that's actually a very protective position. Okay, so one thing that you can do on your own is to practice throughout the day to hold your shoulders up and back and down and like opening up the throat chakra and opening your arms up. Okay. Um, or putting a towel underneath your back and a yoga mat and just allowing the arms to open wide. Okay. Um, those are really great techniques to kind of release that fight or flight response. Neurologically, your body can't be in a fight or flight position with your arms and chest open, right? That's not a protective position. Even if you think about it in like, caveman days, if, going back to like, a predator is coming after you, you're not going to stand there with your arms open and your neck open because that's very vulnerable, right? So that naturally changes your physiological state. It's telling your body that you are more open. It's telling your body that you are more relaxed. Okay. This is a great position with it within yoga. You can also do, try and do a couple minutes of yoga a day. Another thing that you can do is also you can do essential oils. You can diffuse essential oils for relaxation. So, literally, some of the oils that you can use, like lavender, chamomile, um, excuse me, Melissa. There's so many different oils that you can use to try and get a grounding effect through your nervous system. So the essential oils will actually, it's not just that it smells nice, it will actually create a grounding effect. It will actually stimulate different parts of your brain to help with relaxation. Um, so that's another thing that you can utilize. Um, one of my favorite therapies, to be honest with you, is actually craniosacral therapy, and Reiki. So Reiki is like energy work. Okay. It's important to have a plan to combat stress, but it's also important to have a plan to combat the destruction of stress on your body, right? So let's talk about that a little bit more. So if you are somebody who has those digestive issues, so number one, and again, this is for informational purposes. I can't tell you to or prescribe these supplements to you, but make sure you either, if you would like more information about these supplements, you can message me, and I'm happy. I work with patients virtually with functional medicine and health coaching. And I recommend a variety of different supplements. So I do have some of these supplements on hand, but again, this is for informational purposes only, not prescriptive. Okay. So one of the things that I usually always, especially with people with chronic stress, high levels of inflammation, is wanting to calm down that GI tract. So we want things like aloe leaf, we want licorice root, specifically for tightening up those junctions, glutamine and bone broth. So those are really like that collagen. That's really important, is understanding that there's like a heal and seal aspect of your body needs to seal those tight junctions so that you're not getting that inflammatory effect. So you want to do that through elimination diets with those supplementation. Okay. Usually that's something I do with patients as part of my protocols, a little more in depth, a little more tailored to the patient. But really, it's, we want to reduce as much inflammation as possible. Sometimes that's using turmeric, so turmeric oil, curcumin. There's a couple of supplements that I like to use, specifically for um, gut health, decreasing inflammation, GI Revive, and Ultra Inflamex. So those are designs for health supplements as well as metagenic supplements. Those are really great at just calming the GI tract. Okay, so what happens over time is you get a lot of food sensitivities, your body gets really inflamed, it starts having an immune response to everything. You start creating a lot of inflammatory mediators in the GI tract. So you got to essentially just kind of quiet the GI tract down. The other thing you want to do is work on, reducing the pathogen load. Okay, so some people this shows up as yeast, some people this shows up as high amounts of bacteria. So simple things that you can do is start adding garlic to your diet, oregano. Garlic and oregano are amazing with antibacterial, viral, fungal. Okay. Fungal, you can even go as far as tea tree, black walnut. Those are all types of things that help with antibacterial as well as some antiparasitics. Um, as far as more of a parasitic load, I like to use some of the black walnut as well as supplementation with fulvic acid to get uh, and a supplement called Mimosa pudica to help to eliminate parasitic infections as well that could be contributing to a lot of those problems. Okay. Um, the other thing that you want to do is make sure that you're taking a healthy amount of probiotic and prebiotic. Okay. So probiotic is commensal bacteria. It's good bacteria. It's the happy bacteria that your gut wants to help it function correctly, right? Have a healthier immune system. So you want to make sure you're taking a really good probiotic, a lot of diversity, at least 7 or 8 different strains of lactobacillus and bifidobacter. And you want to have at the absolute minimum, 15 billion organisms. Now, if you are somebody with like a lot of gut health issues, you're going to want more than that. If you are somebody who's had a ton of antibiotics, you're going to want more than that. You're going to want like 30, 50 and above billion organisms. You're also going to want, if you are somebody who's had tons of antibiotics, you're going to want a prebiotic in it, which is called FOS, okay, fructose oligosaccharide. That will help to nourish the bacteria and help it grow quicker, okay? And so that you'll get better immunity faster. These will help to actually heal. They like the more commensal bacteria you have, the more that your body will actually start to heal the GI tract lining. The more that you'll be able to start balancing that those neurotransmitters being made, to increase those neurotransmitters being made. Okay, so that if you are somebody who has gut health issues and don't know where to start, I would absolutely start at those points and at the very minimum start doing elimination diets. Okay. Start doing some things that have aloe and glutamine in them. Start using bone broth. Start eating cleaner. Okay. Start pesticides are completely disrupt the commensal bacteria. So organic food is really great. Um, so that's where I would start with your gut health, okay? Because the gut brain connection is huge. And somebody who's experienced chronic stress, if your gut is a mess and you have high amounts of inflammation, it's going to only drive a lot more of the disease process um, with, uh, those types of things, anxiety, depression, and some more of those abdominal symptoms. So, again, I'm Dr. Misty Kosciuszko. Thank you so much for watching today. If you want any more information or have any other questions, please comment below. You can send me a message. I do work with people on an individual basis and virtually. If you would like to schedule an appointment or if you have a question about that, you can go to my webpage, which is www.newhorizonchiro.com, and click on the appointments page. My dispensary is on there if you have a question with supplements. And I'm happy to help any way I can. Okay. Thanks so much for watching, and I will see you guys next week.